The Santa Fe Protocol itself, treatment concepts and results. The importance of the Santa Fe Protocol is not that it slows macular degeneration, but rather that it actually improves vision that has been lost with macular degeneration for the vast majority of people with either wet or dry varieties. It's comprised of three different concepts. The first is ear acupuncture. In the 50s, Dr. Paul Nogier, a French neurologist, identified that there are points on the ear that affect corresponding points in the body. This was validated by Dr. David Allomy, who is professor of ear acupuncture at the University of Paris Medical School. What Dr. Allomy did was poked a needle in the part of the ear that Dr. Nogier said represented the thumb. He then did a functional MRI, a real-time MRI, and lo and behold, the part of the brain that was known to represent the thumb lit up. I use a combination of French and German techniques to increase the production of cortisone and to indirectly stimulate the optic nerve, the retina, and the eye itself. The second concept is a neuroanatomic one. This was developed by Dr. Joseph Wong of Toronto, Canada. In this, I insert very small needles in the fat around the eyeball, not in the eye, but in the fat around the eyeball. These are 0.12 millimeters in diameter, which is thinner than a human hair. They are so thin that they cannot directly penetrate the skin unless there is an introducing tube used, which physicians use to place the needles. Using these needles as electrodes, I then run an electric current back in the back of the eye, and that stimulates the back side of the eye itself. Probably it increases blood flow, but it is possible that it may stimulate the retinal pigment epithelium, which is involved in removing waste products, or possibly it increases photosensor receptivity, or possibly it affects other structures that affect the eye. The third concept is one of French energetics. It makes use of Chinese observations that there are a number of points on the body that affect the eye. These are points that I have validated myself, and there is wide agreement amongst many other observers that these points affect the eye. I take these points, stimulate the entire length. It is very possible that they work by stimulating the parasympathetic system. The eye has a terrific parasympathetic component, and a number of the points are known to be associated with parasympathetic activity. Results. Despite the grim outlook for treating either wet or dry AMD, the Santa Fe Protocol offers hope. To date, I performed over 3,500 individual treatments on 200 patients. 85% of these people are showing improved vision. The improvement is slow, but it is improvement. To measure visual acuity, we use EDTRS charts. These have 5 letters on each line. 3 lines equals doubling vision. As of 2005 December, average response is between 1 and 2.5 letters per treatment. Average is probably 1.5 letters. There are some people who get 3.5 letters. What this means is it takes 3 to 4 treatments to get 1 line's improvement. If 3 treatments gives you 1 line improvement, 6 treatments give you 2 lines improvement, 9 treatments, 3 lines improvement, etc. Yes, the progress is slow, but it's improving vision instead of cutting losses. There are other improvements to functional vision which are hard to measure but are very important. The scotoma, the blank or black spot in the middle of the eye, decreases in size and ultimately disappears. This means that people who had to use peripheral vision to look at a clock or watch TV can now look straight at it. Color vision becomes more intense. One needs less light intensity in order to see. Wavy lines on what should be straight surfaces become straight again, and the fog that obscures vision overall lifts. If a patient has very poor vision, oftentimes they will note improvements and changes quickly. They can pour coffee in a cup instead of on the table. They can recognize individual features on other people's faces, and that at a further distance. They can put toothpaste on a toothbrush instead of on their finger. If vision is better, it oftentimes takes 2 lines of improvement before people recognize that they're making progress. Partly that's because eye professionals have been so adamant that there's nothing to be done with macular degeneration except have gradual deterioration that patients don't want to have unrealistically false hope. Medicare specifically does not pay for this procedure, considering it experimental. However, I am so confident that if you do not gain objective improvement after 4 treatments, I will refund money. I expect that you will get, as a minimum, at least 1 line improvement on either left or right eye, either near or distant vision.